Thank you, Doctor, for joining us in this case study video series, an educational initiative by Himalaya Baby Care. As India's #1 doctor-prescribed baby care brand, we strive to uphold the highest standards in every step of our journey. This case study, Advanced Diagnostics for Pediatric Lung Disorders with Oscillometry, focuses on significant subject in pediatric pulmonology. We are honoured to have Dr. Neeraj Gupta, allergist, pediatric intensivist and sleep specialist, and a senior consultant at Sir Gangaram Hospital, Delhi, with us. Dr. Gupta will share his expertise and valuable insights from a unique case, highlighting innovative approaches in pediatric care. Let's begin this enlightening session.
Namaskar. I am Dr. Neeraj Gupta, an allergy specialist and pediatrician from Sir Gangaram Hospital, Delhi. Today we are going to talk about a very interesting phenomena, a very interesting fact about life. We all understand that in today's busy life, metro cities life, we actually require a healthy life. And for healthy life, we need a healthy breathing, a good breathing. And for good breathing, we require healthy lungs. So we will be talking about healthy lungs and how we can keep their health very healthy. So I will be discussing about a child, a 4-year-old child who presented to us with some breathing difficulties. In the background, this child was born at full term with a vaginal delivery, and at the time of delivery the child was doing fine with a birth weight of 2.5 kilo, and he was discharged on the next day from the labor room. At the age of 30 to 35 days of life, the parents noticed respiratory distress in the form of fast breathing, and child was refusing to feed. Then they presented to the doctor, and on investigations it was found that the child was having some malformation in the lung, which is also called as hypoplastic lung. Very unfortunate for the child, but this baby was actually having right lung hypoplasia, which is a very rare condition which happens somewhere in one live birth out of as many as 1,000 births. So unfortunately, this baby was having right hypoplastic lung. Along with that, the heart was also shifted towards right side, and he was also having some malformations in the kidney. After conservative management, the baby became okay and he was discharged home. Then thereafter, the baby remained okay up till 3.5 years of age. Now for past 6 months, that means since 3.5 years of age, this child has started having some coughing, breathing difficulty, which were aggravated with exposure to dust, pollution, more problems in the night, and then at this time, this child presented to us at 4 years of age. When we saw the child, we felt that probably there can be two problems. One problem that this child might be having a superadded infection or pneumonia on the top of the malformed lung, or this child might be having some sort of allergic or asthma problem. But the question was that how to diagnose. The conventional test for lung function testing, which is spirometry, was not possible in this particular child who was 4-year-old, who was not able to breathe properly. So how he can breathe with the forceful breathing maneuver? So to our rescue, a latest technique or a newer technique which is called as oscillometry, which came to us as our rescue. So we performed oscillometry and we found that this child was actually having mixed lung pathology. That means on the background of restrictive lung disease due to hypoplastic lung, this child was also having some obstructive disease due to asthma or inflammation in the airways. When we gave bronchodilator, the child responded. That means it was clear that because of the environmental pollution, environmental allergens, environmental effect, this child's breathing pipe was actually having some inflammation suggestive of asthma on the top of his already malformed lung, which is hypoplastic lung. We started the child on inhaled corticosteroid as per the standard guidelines, as well as symptomatic management, and we also started the child on some breathing maneuver exercises. In subsequent follow-up, the child's symptoms improved and even the oscillometry parameters also improved. So this case highlights two very important things. One, that children, babies who are actually having developing lungs, they are very, very, very vulnerable to environmental pollutants, to environmental allergens. Allergies are very common. Asthma is very common in these small children. The second important point which is highlighted by this case is that unfortunately with smaller children, there are no functional assessment tools which can be used to actually define or classify or diagnose them early, and so that they are devoid of the treatment. But now with the advent of this oscillometry, which is actually a life-changing or a game-changing tool in the assessment of lung functions, we can actually monitor and measure lung functions after 2 years of age, even in those children who cannot actually perform a forceful breathing maneuver, and we can actually define that what is happening inside the airway, how the airway is getting the air, whether it is narrow, it is tight, how the lungs are behaving, how the parenchyma is, and we can actually monitor the therapy. This useful tool, oscillometry, has also been used for other conditions, like sometimes in post-operative conditions, when the patient is unable to perform a forceful breathing maneuver, oscillometry can easily be done and you can really monitor their functions. This is also useful in pregnant females, where you cannot really ask them to apply a forceful breathing maneuver. This can also be used in elderly people, can also be used in those children and adults who are actually having some neurocognitive behavioral problems like autism and other disorders which are nowadays increasing. This can also be used even to monitor the therapeutic efficacy or the therapeutic side effects. Like for an example, if somebody who is on chemotherapy, then there are certain anti-cancer drugs which can actually cause lung fibrosis. And now this lung fibrosis can be easily picked up by using oscillometry or a serial monitoring of the oscillometric test. So what I want to highlight by this case is that the children who are actually at a disadvantage because of their some congenital malformations, because of their poor chest compliance, poor respiratory efforts, some chronic diseases, and on the top of that, if some acute respiratory inflammation happens, then at that time oscillometry can easily be used, especially after 2 years of age, which it can really define, really help in achieving our goal. With this, I would like to say goodbye to every one of you and wish you a very happy, healthy breathing and a happy life. Thank you so much.
We hope you enjoyed this session and found it insightful and impactful. Thank you. Himalaya Baby Care proudly launches pure cow ghee range with pH 5.5, specially formulated for babies' sensitive skin from day one, that promotes skin immunity, offers an anti-inflammatory effect, protects the skin's microbiome, provides intense moisture, deep hydration and nourishment, formulated with pH 5.5. Looking forward to your valuable prescription support for Himalaya Baby Care Pure Cow Ghee range.